Bismillahirrahmanirrahim. Quote for today is and seek help through patience and prayers. Today I will be doing the critical appraisal of an article, and will be doing this under the supervision of my professor, Dr. Saira Afzal. This is the title of the article, Drug Use Disorders in Eastern Mediterranean Region, a glance at GBD 2019 findings. This is the checklist that I will be using. This is Gather checklist. This is the checklist of information that should be included in new reports of global health estimates. It contains 18 points. Now, what is Gather? It stands for goals, approaches, timings, eligibility, analysis, results, and harms. Goals is defined as the specific objective of the study. Approach is the study design, setting, and participants. Timing indicates the time period. Eligibility details the criteria for inclusion and exclusion. Analysis is the statistical method. Results are the main findings, and harms any potential adverse effects. Now coming towards the Gather checklist, the title of the article shows drug use disorders in Eastern Mediterranean region against GBD 2019 findings. And this is the abstract. As we can see that the abstract of the article shows purpose, methods, results, and conclusion. So the abstract is a structured one. Abstract shows the aim of the study is to investigate the drug use disorders, which are major cause of disability adjusted life years in Eastern Mediterranean region. Now, according to Gather checklist, define the indicators, that is population including age, sex, geographic entities, and time periods for which estimates were made. This point was not followed in the abstract. Next is list the funding sources for the work. This point is also not followed according to the Gather checklist in the article. However, the structured abstract was given. Now, identification as global burden of the disease in the title. This point was followed. And second point is structured abstract with background, method, results, and conclusion. This point was followed, however, the background was not given in the abstract. Materials and method. The GBD 2019 study is a systematic scientific efforts to estimate the burden of the disease and risk factors by age and sex and across 204 countries and territories from 1990 to 2019. All GBD 2019 analysis adhere to the guidelines for accurate, transparent health estimate. A suite of visualization tool is available to explore GBD data, inputs, and outputs. Now, already you people have read the article. I have just written the main points that epidemiological data were used as input for disease modeling. GBD 2019 used ensemble model for cause of death to correct non-reference case definitions or measurement errors for non-fatal sequel. GBD team used network meta-regression on data where 2 months were assessed in the same location, time period, or in the exact population. A simultaneous method was used to adjust for comorbidity. However, for each comorbid condition, a multiplicative disability weight was calculated based on the disability weights for each sequel. Now, materials and methods according to Gather checklist. Regarding data input, it says that for all data inputs from multiple sources that are synthesized as part of the study. Does it describe how the data were identified and how the data were assessed? Yes, this point was followed. It was properly written in the material method. Specify the inclusion and exclusion criteria. This point was also followed. Last is identify all ad hoc exclusions. This point was not followed in the material method. Now, provide information on all included data sources and their main characteristics. This point is followed. For each data source used, report reference information. This point is followed because reference information was given. Or contact name, institution, population presented, data collection method of the data collection, sex, age, range, diagnostic criteria. These points are not given. However, sample size and relevant measurement methods were shown. Now identify and describe any categories of input data that have potentially important bias. This point was not followed. There was no discussion of the bias in the middle method. For data inputs that contribute to the analysis but were synthesized as part of the study. This point is also not followed. Then describe and give source for any source data information. This point was followed. Now provide all data inputs in a file format from which data can be efficiently extracted. That is a spreadsheet rather than a PDF, including all relevant metadata listed in the item. This point was not followed. For any data inputs that cannot be shared because of the ethical or legal reasons, such as third-party ownership, provide a contract name or the name of the institution that retains the right to the data. This point is also not followed. Regarding data analysis, provides a conceptual overview of the data analysis method. A diagram may be helpful. Overview of the data analysis method was given, however, a diagram was not given. Provide a detailed description of all steps of the analysis, including mathematical formula. This description could cover as relevant data cleaning, data pre-processing, data adjustment, data sources, mathematical statistical methods. This point was not followed because there was no formula given, there were no steps of analysis given, there were no data cleaning or data pre-processing shown. According to Gather checklist, describe how candidate models were evaluated and how the final models were selected. In the article, case definition is given properly, so this point was followed. 12th point is provide the results of an evaluation of model performance, if done, as well as the results of any relevant sensitivity analysis. This point is not followed. There was no information given regarding the sensitivity analysis. 13th point of the Gather checklist is describe methods for calculating uncertainty of the estimates. State which sources of uncertainty were and were not accounted for in uncertainty analysis. This point is also not followed there because there was no discussion about the uncertainty and uncertainty analysis in the article. State how analytical or statistical source codes used to generate estimates so that can be assessed. This point was followed. Now, regarding results, the number of people with drugs use disorders reached an estimated 3.4 million in EMR in 2019, which increased by 137% compared to 1990. Drug use disorders were accountable for 0.2% of the total daily, but 2019 the number had risen to 0.51. Total daily number in EMR due to drug use disorders were about 121,000, and the age standardized rate was 167.3 per 100,000 population. I have added only few points from the discussion section that since 1990, the epidemiology of the drug use disorders went through many changes in the EMR. Prevalence, widely of the drug use has increased, female to male ratio in higher now as well, and despite the slow increase during the last 10 years. The largest increase was for the 70s period, who had 31% increase in daily rate. Figure shows age specified prevalence and daily rates in different countries. However, United Arab Emirates has highest increase rates with 267% increase in 15 to 19 age. The discussion also shows the main availability of the study is that the limitation is this is the main limitation. GBD estimates are based on availability data and epidemiological models where enough data are not available. Most of the estimates are made based on a separate scarce data or the data from neighboring countries or regions, which increases the uncertainties of the estimates. Replacing the traditionally important drugs like opioids, and there are illicit drugs like khat, which is not included in the estimates but is common in some countries of the region. According to gather checklist, results and discussion. Provide established estimates in a file format from which data can efficiently be extracted. This point is not followed because there was no properly file format reference was given. Report a quantitative measure of the uncertainty of the estimates. This point is not followed because no uncertainty intervals were discussed. Now 17 point is interpret results in the light of existing evidence. If updating a previous set of estimates describe the reason for changes in estimates, followed no updating was done because no updating was done in the study, however. Last point is discuss limitations of the estimates. Include a discussion of any modeling assumption or data limitation that affects interpretation of the estimate. This point was followed in the article. Now, strengths of the article. Strengths of the article that it provides a broad analysis of the drug use disorders in Eastern Mediterranean region from 1990 to 2019, covering prevalence, daily, years of life living, and years of life lived. Second is tracks changes over nearly 3 decades, revealing long-term trends and patterns. Third is it differentiates between various drug disorders, highlighting opioids as the most prevalent. Fourth strength of the article that it focuses specifically in Eastern Mediterranean regions, addressing unique regional dynamics and socio-political factors. Fifth is it discusses the impacts of laws, suggesting area for the policy intervention and future research. However, the limitations of the articles are it does not detail any study design, data source, or statistical method, hindering the assessment of robustness. It highlights a lack of specific evidence for some countries like Pakistan, indicating potential data quality issues. Third is findings are specific to Eastern Mediterranean region and may not apply to other regions with different socio-political contexts. Funding sources are not mentioned, and better data reporting in some countries might skew results, reflecting reporting quality rather than the prevalence. This is the YouTube link of our channel, and thank you.